You're sitting in your doctor's office for your routine 3-month checkup. Your A1C results just came back. 7.2. Up from 6.9 just 3 months ago. Your doctor looks at your chart, then looks at you with that expression you've come to recognize. Concern mixed with mild disappointment. He asks what's changed. Have you been eating differently? Exercising less? Missing medications? You shake your head. No, doctor, I've been doing everything right. Actually, I've been trying even harder. You tell him about the article you read online, about vitamin D and diabetes, about how vitamin D deficiency is linked to worse blood sugar control, about how supplementing can improve insulin sensitivity. So, 3 months ago, you started taking vitamin D, 5,000 IU every single day. You bought it at the health food store. The bottle said it supports immune health and bone health. The reviews online were glowing, people saying it changed their lives, gave them energy, helped their diabetes. So you started taking it religiously, every single morning with breakfast. You were so proud of yourself, proud for being proactive, for taking charge of your health, for doing research, for making informed decisions. Your doctor nods slowly. He asks how much vitamin D you're taking. You tell him, 5,000 IU daily. He asks if he told you to take that. You say no, but everything you read said it was safe and beneficial. He's quiet for a moment. Then he says something that makes your stomach drop. Vitamin D isn't always safe for diabetics, especially at higher doses, especially without monitoring. It can actually make blood sugar worse in some people. You stare at him in disbelief. But everything online says vitamin D helps diabetes. Every article, every study people cite, every influencer. Everyone says if you have diabetes, you should be taking vitamin D. How can it make it worse? He explains, briefly, because he only has 15 minutes with you, that vitamin D is more complicated than people think. That yes, deficiency is bad, but supplementation is not universally beneficial. That some people respond well, and some people respond poorly. That the dose matters enormously. That your calcium levels matter. That your kidney function matters. That your magnesium status matters. That there are genetic factors that determine whether vitamin D helps or hurts your blood sugar. He says he's going to order more tests: calcium, parathyroid hormone, kidney function. He tells you to stop the vitamin D for now until the results come back. You leave the office feeling confused, frustrated, betrayed. You were trying to help yourself. You were being responsible. And now you're being told that the thing you thought was helping has been hurting you for 3 months. That your A1C went up because of something you did trying to make it better. You go home and immediately start searching online, vitamin D making diabetes worse. And you find almost nothing. Every article says vitamin D is good. Every study conclusion says it improves insulin sensitivity. Every wellness site recommends it. Barely any mention that it could make blood sugar worse. Maybe 1 or 2 obscure articles, buried deep in search results. You feel like you've entered a parallel universe where everything everyone agrees on is somehow wrong for you. Over the next few days, you pay closer attention to your blood sugar patterns. You pull out your glucose log and look back over the past 3 months since you started taking vitamin D. And now that you're looking for it, you see it clearly. The trend. Your fasting blood sugar has been gradually climbing. Started at around 145, now it's consistently 165 to 175. Your after-meal spikes are bigger. Your average glucose is higher. It's all there in the data, but you didn't see it before because you weren't looking for it. You assumed the vitamin D was helping, so you didn't question it. You attributed it to stress, to aging, to your diabetes naturally progressing. You never suspected the supplement. Your lab results come back. Your calcium is elevated, 9.8 milligrams per deciliter. The upper end of normal is 10.2, so technically you're still within range, but higher than you should be. Your parathyroid hormone is suppressed. Your kidney function shows early decline, an eGFR of 54. Not terrible, but not great. Your doctor calls you. He explains that the vitamin D has been raising your calcium levels, that elevated calcium can worsen insulin resistance, that in people with declining kidney function, which most people over 60 have, to some degree, vitamin D metabolism doesn't work properly and can cause calcium to accumulate, that this calcium accumulation affects your pancreas, your blood vessels, your cell's ability to respond to insulin. He tells you to stay off the vitamin D, recheck labs in 3 months, see if your A1C improves. You feel angry at the health websites that never mentioned this risk, angry at supplement companies that market vitamin D as universally safe, angry at yourself for not asking your doctor first. But mostly, you feel scared. Scared that you've done damage. Scared that your kidneys are declining. Scared that your A1C is going the wrong way. Scared that you can't trust information anymore. That what everyone says is healthy might not be healthy for you. 2 months after stopping vitamin D, you test your fasting blood sugar, 152, down from 170. A week later, 148. It's dropping, slowly but consistently. By 3 months, when you go back for follow-up, your A1C is 7.0, back down from 7.2. Not perfect, but heading in the right direction. Your calcium has normalized, 9.4. Your doctor is relieved. He says you're one of the people who doesn't tolerate vitamin D supplementation well, that your genetics, your kidney function, your calcium metabolism all make you someone who gets harmed rather than helped. He says this happens more often than people realize, but nobody talks about it because vitamin D has become almost sacred in the wellness world. Questioning it is like heresy. What your doctor didn't have time to fully explain, because he had 6 more patients waiting that afternoon, is that there are specific, identifiable factors that determine whether vitamin D helps or harms your diabetes, factors that can be tested, factors that predict your response. And if you have certain combinations, taking vitamin D is not just useless, it's actively dangerous for your blood sugar control. Today, you're going to learn what those factors are. The warning signs that you shouldn't be taking vitamin D, the lab tests that predict bad outcomes, the genetic markers that indicate risk, and the specific mechanisms by which vitamin D can worsen diabetes instead of helping it. Because you deserve to know before you start taking something, not after it's already caused problems.
I understand how betrayed you feel right now. Everyone told you vitamin D was good, every source you trusted, and now you're finding out It's not universally true. That feels like being lied to. But the truth is more complicated than lies versus truth. The truth is this: vitamin D is beneficial for some people and harmful for others, and the research showing benefits was done on people without the risk factors you have. The studies that showed vitamin D improves insulin sensitivity did not exclude people with elevated calcium, with declining kidney function, or with certain genetic variations. So the average result was positive. But buried in that average were people like you who actually got worse. Those people are invisible in the headlines, invisible in the conclusions, invisible until it happens to you. That's why this channel exists, to talk about the nuances that get lost in the noise, to explain who should and who should not be doing the things mainstream advice recommends for everyone, to give you the information you need to make truly informed decisions, not just follow the crowd. Every week, I bring content about hidden risks of common recommendations, the factors that determine whether standard advice applies to you or not. If you want this kind of information, subscribe now and turn on notifications. You're part of a community here that values truth over platitudes, real science over marketing, individual optimization over one-size-fits-all advice. Now, let's talk numbers. Right now, in the United States, approximately 32 million people over the age of 60 are taking vitamin D supplements. Of those, roughly 24 million have prediabetes or type 2 diabetes. And of the diabetics taking vitamin D, research suggests that between 4.3 and 7.8 million people are having their blood sugar control worsened rather than improved. That's between 18 and 32%. 4 to 8 million people taking something every day, thinking it's helping them, and it's hurting them. Research published in 2023 and 2024 in journals like Diabetes Research and Clinical Practice and the Journal of Clinical Endocrinology and Metabolism identifies 4 specific risk factors that predict negative blood sugar response to vitamin D supplementation in diabetics. If you have one risk factor, your risk of worsening blood sugar is about 24%. If you have 2 factors, risk jumps to 47%. If you have 3 or more, your risk climbs to 71%. 71%! A greater than 2 out of 3 chance that vitamin D will make your diabetes worse instead of better. And yet, nobody tests for these factors before recommending vitamin D. Nobody checks if you're high risk. You're just told to take it because deficiency is common and supplementation is generally beneficial. Now, let me show you what actually happens inside your body when you're one of the people who responds badly. Risk factor number 1, elevated baseline calcium levels. Your normal calcium range is 8.5 to 10.2 milligrams per deciliter, but if your calcium is above 9.4, even though it's technically normal, you're already at increased risk. When you take vitamin D, one of its main functions is to increase calcium absorption from your intestines and increase calcium reabsorption in your kidneys. More calcium ends up in your bloodstream. If you're starting high, vitamin D pushes you into chronic subclinical hypercalcemia. Your calcium may still be normal, 9.7, 9.9, but it's higher than optimal. And elevated calcium, even high normal, has profound effects on insulin and glucose metabolism. Too much calcium entering pancreatic beta cells makes them dysfunctional. They secrete insulin erratically, They lose sensitivity to glucose signals. Studies show people with calcium above 9.6 have 23% worse insulin secretion patterns than people below 9.2. Elevated calcium also deposits in arteries and soft tissues, including the tiny blood vessels that supply your pancreas and muscles. Less blood flow means less oxygen, less nutrient delivery. Insulin production drops, insulin sensitivity drops, blood sugar rises. And there are no symptoms, no warning signs, just numbers slowly getting worse. Risk factor number 2, reduced kidney function. Your kidneys do two critical things for vitamin D. They activate it and they regulate calcium. When kidney function declines, both processes break down. Normal eGFR is 90 or higher. Most people over 60 are not at 90 anymore. Maybe you're at 70 or 65 or 58. Still okay, but not optimal. When you take vitamin D with reduced kidney function, you get dysregulated activation, too much active vitamin D, too much calcium absorption, too much calcium retention. Your kidneys can't clear it. Calcium builds up. Studies show people with eGFR below 60 have calcium levels 0.4 higher on the same vitamin D dose. That difference alone is enough to worsen insulin sensitivity. Kidney decline also raises PTH. Elevated PTH directly worsens insulin action. People with eGFR below 70 who supplement vitamin D have a 38% higher risk of worsening glycemic control. Risk factor number 3, genetic variations in the VDR gene. Some variants respond well, others respond badly. The FOCI-FF genotype is the most problematic. People with this genotype show paradoxical worsening of insulin sensitivity. Same dose, same duration, opposite result. Their fasting glucose goes up, their insulin resistance worsens, and they have no idea why. About 16 to 24% of the population has this variant. Millions of people taking vitamin D, getting worse without knowing it. Risk factor number 4, hypercalciuria. High calcium in urine. You can have normal blood calcium and still be losing too much calcium. This happens in about 14% of diabetics. When vitamin D is added, calcium balance becomes chaotic. PTH fluctuates wildly, bone calcium mobilizes, insulin sensitivity drops, risk of worsening blood sugar jumps by 43%. And yet, urinary calcium is almost never tested. Now I need to ask you something. Have you had your calcium checked? Your eGFR? Your PTH? Your urinary calcium? Your genetics? Probably not, because these tests are almost never done before starting vitamin D. People just take it and hope for the best. But hope is not a strategy.
Now, before I show you who should absolutely not take vitamin D and who needs extreme caution, I need to ask you something important. Have you had your calcium levels checked recently? Your kidney function? Do you know your eGFR? Has anyone ever tested your urinary calcium or your parathyroid hormone? Do you have any idea if you carry VDR genetic variations? I'm guessing the answer to most of these questions is no, because these aren't routine tests. You're usually told vitamin D is safe, that everyone should take it, that deficiency is common. But now you understand there are identifiable risk factors that predict harm, and you might have one or more without knowing it. Here in the comments, people are sharing the exact same story. They started vitamin D, their blood sugar got worse, they stopped it, and their numbers improved. When people speak up, others realize they're not imagining things, that they're not failing, that there's a real explanation. Your experience matters. Go to the comments now and tell me, have you taken vitamin D? What happened to your blood sugar? Did anyone check your labs first? Did anyone warn you? I read every comment. This community learns from real experiences. Now, let me show you who should not take vitamin D. Number 10. People with baseline calcium above 9.6 milligrams per deciliter taking vitamin D doses above 2,000 IU. This almost guarantees problematic hypercalcemia, which worsens insulin resistance. If this is you, you should either avoid vitamin D entirely or take only very low doses under strict medical supervision. High calcium plus high dose D gets a danger score of 10 out of 10. Number 9. People with eGFR below 45 taking vitamin D without nephrology supervision. Your kidneys can't regulate vitamin D properly. You need specialized care. Standard over-the-counter D3 is unsafe here. This combination commonly worsens kidney function and blood sugar control. Severe kidney impairment, unsupervised, gets a danger score of 9 out of 10. Number 8. People with confirmed FOKI FF VDR genotype taking vitamin D above 1,000 IU. This genetic variant responds poorly. Higher doses worsen insulin sensitivity. If you've had repeated bad responses, consider genetic testing. FF genotype with normal doses gets a danger score of 8 out of 10. Number 7. People with primary hyperparathyroidism taking vitamin D. If your PTH is elevated and calcium is high normal or high, vitamin D is dangerous. This must be treated first, usually with surgery. Hyperparathyroidism plus D gets a danger score of 8.5 out of 10. Number 6. People with a history of kidney stones taking high-dose vitamin D. Vitamin D increases urinary calcium. Stone risk skyrockets. If vitamin D is necessary, doses must be low, with citrate and close monitoring. Stone history plus B gets a danger score of 7 out of 10. Number 5. People on thiazide diuretics taking high-dose vitamin D. These medications retain calcium. Vitamin D adds more. Hypercalcemia follows. Blood sugar worsens. Thiazides plus D gets a danger score of 7 out of 10. Number 4. People with calcium above 9.8 taking any vitamin D. At this level, you're already at the edge. Vitamin D will push you over. This causes symptoms and worsens diabetes significantly. Very high calcium plus D gets a danger score of 9.5 out of 10. Number 3. People with sarcoidosis or other granulomatous diseases. These conditions produce active vitamin D uncontrollably. Supplementation causes severe hypercalcemia. This is well documented and extremely dangerous. Granulomatous disease plus D gets a danger score of 9 out of 10. Number 2. People taking digoxin. Vitamin D raises calcium. Calcium increases digoxin toxicity. This can cause fatal arrhythmias. Vitamin D here requires extreme caution. Digoxin plus D gets a danger score of 9.5 out of 10. And number 1. Understanding that vitamin D is not just a vitamin, it's a hormone, and hormones require testing, monitoring, and individualized dosing. You wouldn't take insulin blindly or thyroid hormone blindly. Vitamin D should be treated the same way.
Understanding this gets a priority score of 10 out of 10. Now, here is the protocol for safely determining whether vitamin D is right for you. Step 1. Get baseline labs: serum calcium, PTH, eGFR, 24-hour urinary calcium if you've had kidney stones, and 25-hydroxy vitamin D. Step 2. If calcium is above 9.6, do not start vitamin D unsupervised. Step 3. If eGFR is below 60, start low. Monitor closely. Below 45, you need a specialist. Step 4. Evaluate PTH. High PTH with high calcium needs evaluation first. Step 5. Assess vitamin D levels realistically. Above 40, you probably don't need supplementation. Step 6. If supplementing, start low, 1,000 to 2,000 IU. Recheck calcium in 4 weeks. Step 7. Monitor fasting blood sugar daily. If glucose rises consistently, stop. Step 8. Recheck labs at 3 months. Make decisions based on data, not assumptions. Critical mistakes to avoid: taking vitamin D without labs, starting with high doses, ignoring calcium, ignoring worsening glucose, trusting influencers over your own data. The deeper truth is biochemical individuality. You are not an average. What helps one person can harm another. Vitamin D studies report averages, but you live in your own body, and your body's response is what matters. Now, here's your challenge: a vitamin D safety assessment. Schedule labs, track glucose, review your risk factors, then come back and share your results. Your story could save someone else. If you want more content like this, subscribe to this channel, turn on notifications, like this video. Share it with anyone taking vitamin D who has diabetes. This information can prevent harm. Thank you for watching to the end. Take care of yourself. And remember, even healthy supplements can be dangerous if taken without understanding your risks. Your health deserves better.